Hello and welcome to today's webinar with eLotus, your leading provider of acupuncture continuing education. My name is Donna Chow and I'll be hosting and moderating today's class. For over 20 years, we have been hosting continuing educational seminars, and today is going to be a real treat for you. Why? We've invited one of the country's best Chinese acupuncturists who is over 80 years old and has over 50 years of clinical experience. He has studied with many masters and is eager to share everything he knows about getting the best acupuncture results. Today's webinar is Ashi Points for back and hip pain, master lessons of over 50 years presented by Kai-Fong Tu. Class will run from 9 to 1 p.m. Pacific time and we'll have one break in the middle. Before we begin, let's go over some important information about the chat room, instructor questions, and your CEU quiz. First, please set your chat preference to everyone so that everyone can be part of the conversation and see what you are typing and participate in class. For questions to Dr. Tu, please type them directly into the Q&A box. And finally, your CEU quiz. It will be ready tomorrow and you'll be notified by email once it's available. Our speaker today is Kai-Fong Tu, who specializes in the treatment of sports injuries and traumas to the muscles and bones. With 50+ years of rich experience and knowledge, patients can often see immediate results and quickly recover from pain. He was a professor of the Chinese Academy of Traditional Chinese Medicine, Orthopedics, and Traumatology, a member of the Chinese Pain Society, a licensed California acupuncturist. Let's begin and welcome Dr. Tu. Today's class is a little different from the usual. Dr. Tu will speak in Chinese and someone will translate to English. This experience will be similar to studying in a TCM hospital in China, where you will be able to observe everything the teacher does in the clinic, and thanks to a translator. Dr. Tu, unlike most TCM doctors, is eager to share everything he knows because he shares our vision of bringing TCM to the Western world. We do kindly ask for your patience. Dr. Tu speaks slowly and can't hear very well at his age. So today, he will summarize the essence of acupuncture with pearls here and there and show you exactly what to do so you can replicate what you've learned today and achieve the same immediate results. All right, let's go ahead and welcome Dr. Tu.
Hi, welcome everybody. Today is March 8th, and this is our second class for Dr. Tu's demo for his Ashi Points needling. We decided this class, we should do it this way, where I just talk about the intro quickly so that we can get on to the meat and potatoes portion of the lecture where he does the demo. So this way it's a little bit faster, okay? For those of you who weren't here last time, I included some of the good points from the questions into the intro here. So people who were here last time plus new people here this time are going to get both the information on the tips that Dr. Tu has from his 50 years of experience doing the Ashi needling. Okay, so let's get started. So the overview of today is we're going to go over the key points, number one, of his style of practice, and then we'll do the demo, followed by a Q&A, and also advice for new practitioners. Okay, so in the beginning, when you first graduate from school, there are so many different acupuncture styles. And which one do you choose, right? Which one do you want to specialize in? Because they all seem to work. Some work maybe better than others. So you really have no idea in the beginning until you try different styles on different patients. And Dr. Tu went through the same thing when he started practicing. So he studied with various masters throughout China. And at the end, figured out that the simplest way is the best way, which is to do Ashi Points. And there's a lot more than just find the pain and needle the point. So let's keep going and then see what he has to say about that. So as you can see in this slide, there's so many different acupuncture, right? It's not to say that Ashi Point is the best type. It's just whatever suits your need because, not everybody likes to do Ashi style. They like to do maybe seasonal acupuncture, or their patients may not be so, open to bloodletting and also this style of acupuncture, which is a little bit more painful than, let's say, Japanese needling. Okay, next slide. So learning from a Chinese sifu. So usually when you learn from a Chinese sifu is a little bit difficult than a Western one, I would say, because first you need the introduction. Somebody needs to introduce you to the teacher. If you just go cold turkey, usually that won't work. And then when you start studying with the sifu, the expectation is that they will have you do a lot of minimal work, meaning like, you sweep the floor, or you do bring the tea to the master, or you wash the cups, or all kinds of that kind of stuff just to help out. And this is sort of the same as Kung Fu, where they want you to do the horse dance. So doing the horse dance, number one, will help train your legs so that you're strong, so that you can do the other movements, right? And second is to test your patience. So the teacher really wants to see if you have what it takes to, to be the student. Because when a teacher becomes high level like that, they are choosing their students. And students also at the same time are choosing their teachers too, right? Who you want to learn from. But not all teachers will accept a student, but so it's just really up to you on how dedicated you are. And we're very lucky here today that Dr. Tu is able to share with us his 50+ years of experience, selflessly, because he feels this is towards the end of his career, and he would like to let everybody know what works best in his clinic, because he doesn't really want to pass it down to no one, because I don't really think he has a disciple. All right. Next slide. So Dr. Tu learned from many different teachers in the 60s, 70s, and 80s. And then he concluded, like I was telling you, that Ashi needling is the most practical and the most effective. Now, let's go on to the important parts, the key steps in needling. Okay, so these are just steps that steps and tips that I'll go over, and you will see them all during the demo. So I recommend you to, later on after class is over, watch the demo again and review these points, and then see them at play during the demo, because he really does follow what he teaches. And then these are the key points. Okay, so first you want to ask the patient to identify the most painful area with a finger. Where is the most painful area? Sometimes it's one point, sometimes it's an area. All right. And so from that area or that point, you want to palpate for any kind of hardness or cord. Cord is something that Dr. Huang Li-Chun also uses. It just feels like there is a cord, something hard underneath, in like a feeling of a cord that you can go like this and it will click, 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 that kind of sound. So underneath the skin. So palpate for that cord or that hardness. And number three, what you should do next is hold it with your one finger and don't let go. Because if you let go, you go take your needles and come back to the patient, you might lose that point of where the hardness is, because that's where you're going to do the insertion of the needle. So you want to hold it, take the other hand, and then needle. Okay, so in order, he says, for the treatment to be effective, you don't just stick the needles in. You need to elicit a de qi sensation, which means the patient has to feel, sort of like soreness, a little bit of distension, generally the de qi sensation. It's not a pain per se, because he says when you feel just a sharp pain, usually you either puncture a vessel or a nerve. If you have an electrical feeling, it's a nerve. If it's just pure pain, usually it's a vessel. But you need to feel that type of de qi, swelling and distended, type of soreness, type of sensation for the acupuncture session to work. So these are the 5 key steps. Now, going on to the tips. So what do you do when you're looking for the Ashi point, which is, the knot or the cord at the painful point, and then you cannot find it? So what he says is that you need to expand the area and then keep searching for it. Because sometimes, because the body is all connected, sometimes when the pain is in one spot, it's not necessarily there that is problematic. It could be further down or further up. So expand the area of search until you find that knot, okay? Number 2, the needling hand is not as important as the other hand that stabilizes the point to needle. So what he means is the point, the hand that you're using to find the cord or the knot is more important than the needling hand, because you need to stabilize that, because that's 50% of your treatment. stabilizing and finding where to needle, and then needle it. So he says, because the tendon tends to be slippery, if you let it go and come back, you're going to have to repalpate again. So just hold it and then needle. Okay. Next, he uses a gauge 30 needle. You need to use a thick needle to attain this kind of strong stimulation. I suppose he sees mostly Chinese patients. If your patients cannot stand the 30 gauge, you can do 32, 34, 36. The effect of treatment most likely will be not as good, not as strong. This is the whole reason why Master Tong does Daoma, because he uses 3 needles to sort of have the effect of synergistic effect of 1 + 1 = 3 or 4. Same thing here. If you're going to use only a few needles, you want to use a thicker gauge needle. Okay. Number 4, you want to wear gloves, because he does also do bloodletting. And sometimes even when he pulls out needles, bleeding may happen. So it's better to wear gloves. Number 5, I ask him, because some teachers have this preset rule of not using more than 5 or 6 needles. Some use no more than 3. But he says, use as many needles as you need to relieve the hardness and the pain. Okay. Number 6, you work on one area, the primary area, to first attain the relief in that general area. Now, later you ask the patient how they feel. If they feel, it's generally better, but then still there's some more, usually those are the secondary areas that you want to work on. And you can either work on it right there and then, or you can work on it in the next treatment. But usually he does it right there and then, because he wants to get rid of all the pain all at once. Next is De Qi. Okay, De Qi is when the needle touches the knot. You need to move it up and down to break it. So you're penetrating through the knot. So for example, if this is the knot, this is the needle, and when the needle touches the knot, that's not enough. You want to go through it, break it up, basically, is the idea. Number 9, when the patients are very sensitive to pain, what you want to do is acclimate them to the needle by doing cupping, or by doing guasa, or by doing bleeding in that local area first, sort of to desensitize the area. And then you can go in with the needling. It won't hurt as much then. Okay, that's a tip. Number 10, there's no need to leave the needles in for 30 or 40 minutes. He says that if you can attain the De Qi sensation, it's fine to remove the needles, because he feels, that's what makes it work. But if you want to leave it for 30, 40 minutes, that's great. Patient will get, whatever rest they need in the bed. And if they do fall asleep, that makes the treatment even all the better, because they will feel great when they wake up. But it's mostly, he says, very frankly, that it's really to make the patient feel like they're getting their money worth, because I remember Dr. Tan also said the same thing before, where patients would complain to him that, hey, you treat my problem only with 1 or 2 needles, that's not right, So then Dr. Tan would tell them, oh, well, do you want me to needle you more? It's just more pain. I charge the same. It's up to you. So then the patient really don't know what to say, but then it just feels like, they feel like more is better, but not necessarily, in this case, De Qi is what's important. Okay. And then on this style of needling, Dr. Tu's style of needling, what happens is after his treatment, the patient will have more soreness in that area because it got worked on a lot. And then gradually it will become better in a few hours to a day, and then the pain will be gone. So this is very different from other types of needling method where, the patient feels great after the session and then they go home, or right after the session, the problem comes back and they need to come back for another treatment. So this is completely different. So it's something that you can experiment in your clinic. On some patients, use one style of acupuncture where that does happen, the pain returns or whatever, the condition returns, but it's lessened, but they return. As opposed to using this style where, there's going to be more soreness, but the pain doesn't return. So often Dr. Tiao jokes with me, he says he also usually sees patients only once because he takes care of the problem once and for all. And then next time he'll see them is usually like next time when they have some major other problem that they'll come back. Sometimes it's like 20 years even he has a patient that came back because he sprained his ankle. But other than that, you shouldn't have to come back for multiple sessions with this method. It's that effective. So pay attention during the demo and really look at how he uses his hands to palpate and how he needles, okay? Contraindications on Ashi needling. So on this section, he's talking about when you don't want to use Ashi point needling is number one, when you're pregnant, when the patient is pregnant, especially on points of the back, on the lower back. And if you're 8 months pregnant and above, you don't want to use any needles, okay? And then also two, you don't want to needle on the thoracic points because you can easily have pneumothorax. He demonstrated in the last class how to needle the thoracic points. Some of the points he did were perpendicular, unlike what we learned in school, which is, you want to go diagonally, but at an angle. But he does, he does, I would say, more aggressive needling. But he says in the last class that you should start out slow. Generally, just don't do it to be safe, because in this country, it's there's a lot of lawsuits, and just to be safe for the patients as well. And secondly, if you like to practice slow and practice shallow. Don't just go in all the way in that area, the thoracic area, because it can be very dangerous, okay? And then next is, when do you use cupping? Okay, you use cupping when the patient is afraid of needles. So you work on the local area with cupping, and generally the patient will feel like, oh, there's like tightness and tension, and the area is being worked on, and then you needle, and the sensation for the pain won't be as sharp then. Okay, then next is, when do you bleed the patient? Okay, you bleed the patient when there's no obvious pain or you don't feel any obvious knot. So then after you bleed, you can look for the knot or look for the pain, because after you bleed, the structure is sort of rearranged, and it's easier for you to find the problematic point. Always use disposable cups and wear gloves. Again, re-emphasize this point. And also, another tip on bloodletting is that, in that last class, people ask, when he used the lancet, how many holes do you puncture? In general, the more severe the condition, the more bloodletting you should use, the more holes you should puncture. But average, you would do 3 to 5 pokes, with 1 cup. That's the general, but you can do up to 5 to 7 to 8 if it's really severe. I don't think you need to do more than that, because it is still painful to be, making those punctures. As you can see from either today's demo that he will do if you have a patient that needs bleeding, or you can see in the last class video that, he does a lot of bloodletting, and in some patients it does complain that it's painful. Okay, so when the case is severe, use a cup to bleed first and find the hard spot and needle. So we cover that. That's a repeat. And then, so another tip is, after bloodletting, you want to tell the patient to not shower or bathe for 12 hours. Okay. And then there's no need to put on any ointment after the bloodletting, because the sterilization with alcohol before should be done. And, the patient should be able to recover itself from the holes. And that is precisely why you don't want to shower or bathe, because you don't want to get it infected. Just let it dry, and then the holes will close itself. Okay. On the areas where you cannot needle, and bloodletting is a better choice, safer choice. So where would those areas be? So first is in the Gaohuang area in the back. You don't want to needle there, it's better to bloodlet there. And if you weren't here last time, one of the biggest takeaway tip is that if your patient complains of any arm numbness, 90% of the time is a problem with the thoracic area, Gaohuang area, not the neck. So if you treat that area and let blood out, you can treat the arm numbness, okay? That's just a little tip I remember from last time, and I thought I'd share with you. And the second is second area where it's better to bleed and not needle are the fingers and toes, because there's just not a lot of space and it's very painful to needle. So it's better just to squeeze out some blood there. Okay. Next, contraindicating on bloodletting is patients who are on blood thinners. You don't want to do the bloodletting if you can help it. And also diabetic patients. These two groups of patients, you want to be careful. He does still bleed them, but he just bleed them minimally. And you don't do it if you don't have to. Obviously, they'll have to have a severe case of pain or whatever it is for you to bleed them a little bit. Okay. And that would be the only time you would. All right, so that concludes the introduction. I went over it quickly so that we can go on to the demo portion where you can see, the exciting part of the class. But do go back to the tips and review some of them, because those are like his conclusion of what's important from his 50 years of practice, what you should focus on and pay attention to when you're practicing Ashi point needling. All right, so let's get on to the demo part of the class. We'll take a break for 10 minutes and return. Okay, thank you.
Okay. Can you guys see me? Okay. Back. Okay. Okay, I'll go behind. Okay, so we have our Okay, so we have our first patient here, and he's going to describe a little bit about what his condition is, and then the doctor will go ahead and treat him, and you guys can see the whole setup. There you go.
不要紧张，
真的。
很紧张。那个你这个怎么不舒服？
I feel okay today. I still have a little pain in my back, but not a lot. The pain is mostly on this side. Yeah. Yeah. On the right side, like right here. Right now, not too much. Maybe like 5. Yeah.
你那个趴着。
Alright, now face down.
这个不要。
Check your back first.
有个洞。这个洞。
Okay.
We're going to lower
The audience didn't see where the pain. Can you show where the pain is again?
It's
Which area?
right here.
We're going to lower your hands a little bit.
That's right here.
我们他现在就是检查他的how did you feel?
It's okay right now.
Okay, so he's palpating to see where the pain is. Let him know when you feel pain.
Like a little bit lower.
Okay, 他说有点再低一点点。
中
Okay, this one is a little bit loud.
Yep.
Did you feel that?
Yep, I feel.
How about here?
Yeah, that's the one.
Okay, 他说对，这里痛。
Okay, he says that's where it hurts. The doctor is saying that there is a growth.
望得到吗？
Yeah.
有
Yeah,
望到吗？
this is the pain point.
Yeah, around that area.
有个那个
Right here, yeah.
有个结那个
Nodule.
Nodule, yeah,
这个
I
一按一
think
下就
it's
你看，一按一下就知道这里。
Okay, when you pressure and you can feel the nodule is here, yeah, here.
这是很简单，其他都没有。
It's
he
very
says it's
simple.
very easy.
这个是这个
Here,
有
Do you feel pain there?
Not too much there. It's almost
没有，这里没有很痛，
啊，
这里没有很痛。他说
没有很难，
more like here.
这里看出来。
他说下面。
Yeah, that's
Yeah.
Yeah, he's saying that's it.
这里 不是很痛
OK，
这里疼，但是很简单啊，这个下面，
OK，
哎
就是 underneath，
Yeah, underneath.
在骨头下面吗？还是
啊，
That's it.
它不是骨，这个是在下面，
？OK，OK，
这骨头的下面，
It's underneath the bone.
这个是这个下面，这个
Mhm.
很简单，
He keeps saying it's easy.
这里
All right, guys, let's
这
go.
里
Here is not pain, but
No.
we see the
It's radiating.
Yeah.
这里不疼，这里疼，
对，这里的，
Doctor's saying it doesn't hurt here, but it hurts down here. But he's feeling something right here.
这个很简单啊，这筋疼，肌肉疼，
OK，
先拔个罐子，拔个罐子，
he say this is because the tendons
Are
Okay,
twisted
yeah,
or
tendon.
the tendon.
So now we're going to do the cupping.
Okay.
你这个头没带来，没带是哈，
先做
先拔个罐子看看。
All right, we're going to do the cupping first.
Okay.
这个头没带，这个合后上肌，
横抽上去。
合谷后上肌，这个，但今天头没带，这个。
We do the cupping on the pen point first.
这个做，
It's the only one.
这里也开也可以。
For the second one on the area. How did you feel? Is that okay?
Yeah.
Okay. 哦，没问题。
这个
Just speak up.
这个是最简单的。
Okay, so now we put the two cup on the area within the main temple point and then the
这里
secondary.
这里有一点，
How did you feel on the side?
I think he's hitting something there.
有一点，
Oh, okay, you feel something here? 对，他说这里有。
Yep.
我这里，
Mhm.
嗯
Yep.
对，他说这里。
嗯，
So that's the third point. You feel the pain or soreness or numbness?
Yeah, I feel like kind of sore.
Sore, okay. 他说觉得酸。
所以这里
So Dr. Diao find another area. That's the spot.
一个这个
Oh, wait. Into pot.
摸一下，
Okay. Go ahead. Grace.
Okay, so now we find the third part, which patient feel the soreness. Okay. Oh yeah, I see. Here is another. Here, yeah, they have the kind of tightness, and then I feel a little bit nudger
这
too.
么容易玩的，
Mhm. How about here? Okay, so 1, 2.
就是这里，
So which one is more severe? Okay, yeah, 对，他说这里。
对啊，
对
就是这
So
这里
this is the third point. 还要一个罐吗？还好，okay. So we change the cup to do a little bit cupping first.
OK，
Okay.
Yes, no pain. 他说这里没有很痛。
现在拔罐子以后就不用了。
Okay. After cupping, you will feel release a little bit. So now we do checking one more time after the cup.
拔罐以后没那么疼，只是很轻，这样
Okay.
这个
When we do the cupping, we want to let the pain point more obviously to find out which one is the first one, which one is second one. So now Dr. Liao is trying to, looking for which area. So later on, we're going to do the needle.
这个腰四五都有一点，这里不同，但是还是有一点点肿。
Oh, okay. There is not pain, but they feel like a little
A
bit,
growth.
yeah, a grow and like kind of swallow.
Okay.
Yeah.
So he said there's a growth and swelling in
Mhm.
that, in this back area.
Okay, so we're going to have two needles. One is here, one is here. Okay.
不放血可以。
Okay. So no bleeding is okay. Okay. So 要多长的针呢？来这里，要不要带？不用带。3寸，OK， 好，3寸。
The growth is like a nodule. Jacqueline.
Okay.
先试试看。
Yeah, the first point we feel have a nodule, so we're going to do the needle right now.
可以喏，
How did you feel? It's okay?
这样子，慢慢扎进去，
Okay, slow down.
一层一层。
And then they have the layer. You have to feel the layer. They have the skin. They have the
这个是
muscle.
这个是中层的。
Okay, that's for middle layer. So you have to slow down and one layer by second layer.
底层了，酸不酸？不酸，痛吗？
How did you feel? You feel pressure?
好像没有，没有。
他说没有太多的感觉。So now we pull needle a little bit up and then we try to find
慢慢扎进去。
and slow down.
这个有些，哎，这个比较松了，
Okay, now
Soreness.
deeper. Did you feel soreness?
松张
Something?
没有。
Not numbness, soreness? No? 哦，OK，他说有点像，好像有点这样子，
没有。
对对，有一点点感觉。
这个
How about here?
没有。
Is it?
嗯，
Any feeling?
No, but when you hit something, I feel like a tingling.
Tingling，他说有点像，好像在这样子捏你，对对对。
这个很深啊，最长的。
Okay, now it's very deep because this is
这个
like
到骨头了。
we hit the bone right now.
啊
Okay? You okay?
酸张
You feel soreness?
No, I think I'm okay.
痛，
You feel pain? We don't want the sharp pain. We don't want the stabbing pain. So if you feel pain, you just say out loud.
No,
酸张还是痛。
What do you say?
I just felt the needle.
Okay.
This whole time I haven't really felt the needle.
他就是感觉到有针在刺他，但是并不是很痛。
嗯，这个，这里不太敏感，可以附近再找。
Okay,
这个没敏感，这个不太敏感，
OK
附近再找。
okay. So after the first one, we're going to do the second one, and then we're going to find the cross, the point we just do earlier.
你看，这，啊，这，慢慢插进去。没有，没有，没有。不太
No, not there.
慢慢
如果有的话，针是什么感觉？如果觉
它会比较硬啊，
哦
有
，OK
阻力，
okay.
它会
If
抓不
if
下。
you find the point, you can feel the needle hit something. So they're going to have, like a different feeling when they very smooth. So when you hit some nodule or one kind of the tendons, you can feel the difference.
这个表层，这个最表层，哎，
很
没有
硬吗？
没有啊， 有没有？有
How
没有
did you-
酸到？没有。
You feel soreness or numbness?
I don't feel anything.
有
OK，他说没有感觉。
这个呢
How about right now?
有没有？
No，
No,
他
nothing.
没有没有。
这个呢？
嗯。
哦，到底。
到底 OK。Now is in the
没关系，
OK，
其实他也不厉害。
不是很痛。OK，可以放着。
嗯，
Pain here
那
soreness 酸
对，
here
对啊，
OK 对这里
对对，
OK now we find the point
放一个好了，
好换一个
放一个。它不在上面，这个没有找到，就下一个。
OK the first one we didn't find the pain point the way patient say he didn't have too much feeling so now we find the location a little bit lower
没有酸到没用。
Okay, we have to find a point the patient feel soreness or pressure or numbness. So that will be, hit the point we looking for.
有没有？
You feel that?
He said, he
哦，
said
有
there.
了，有了。
那个
嗯哼，
有，可以周围找。
Okay, so we have to search in area. Sometimes the first time you couldn't find it, so you have to keep searching that the real point we looking for.
很简单，那个不严重一点点，
OK，所以为什么不留着要拉起来呢？就是
不留也可以，有酸到留不留的，可以因为它不严重。
Oh, okay. Because the patient not really severe, so Dr. Diao say you can just when you find it and you just pull out the needle and try the second one. So this kind is a lightweight treatment for the patient.
哎，喏，
More sore than pain.
酸，他说
More sore
酸，
than pain.
这个酸，
Right
对，
there.
他说这
酸吗？
soreness
喏，
No, not yet.
no，他说
No,
还
not
没
yet.
有。
嗯，没有。这个
He
酸
says, ooh,
酸
酸
酸到
soreness or painful?
I felt like kind of like soreness, but it went away.
Oh，
says he felt
他说
soreness, but
一点
it
点。
went away.
一点点，
嗯哼，他说 who
其实没什么，挺轻微，
Dr. Diao say you okay, you know.
最简单这一次。
This is very simple.
喏，
Okay, now we keep searching right now.
I feel a knot there.
这有
Says he feels a knot.
他说不是在这
Feels
里
a，knot right here. Right here.
对，
Yeah.
在
他是在骨筋跟骨头上吗？
酸
There.
酸
He feels
胀
pressure.
胀，
胀哦，
嗯
胀就对了，
嗯
在这里啊。
，OK
所以啊，
OK now
就是它不明显的时候，你要周围找，
OK
多找一下，它
OK
总会找得到。
OK. Well, when the pinpoint now, obviously you have
酸
to
哦，这
find
个
it.
酸
We got
Oh,
it.
叫酸
Got it now, right?
This is like going
哦
fishing. We got the
对，
fish.
所以呢，这些都还是没有找到。
Okay.
那
The
这个是
earlier we didn't find the right point, so
慢
now
慢慢一定会找得到。
okay. Take
Like that. I feel it radiating over around there.
yeah, that's the point.
It says
Okay.
it feels pressure and radiating around there.
对，一定会找得到，找得到，找了有酸胀，有
OK
酸胀一定有效。
Okay. When you find the point, patient feel pressure, soreness, and then and that means, the treatment will be very good.
这个酸，这个对
Sore, OK，
酸，
他说很
你不
酸，
很酸，
很酸
的。有时候你不是这里不是要再扎也可以，你
OK
按一下，按一下，哎，很酸，
OK.
酸酸。
Sometimes we can try to add another needle, use your finger to try to pressure them, and then you will feel something there. You can add another needle. 所以我们再给他加一针。
按一下，它有酸就也有效了。
哦，OK。那如果再
也可以
加一针呢
扎，也可以扎，也可以不扎，
？OK.
反正
So
有酸痛。
That's
也
optional.
也
You
一
can
下
add the second one to
其实它不
stimulate the
其实
point.
其实它不严重，哎，哈哈哈，一样，没拔进去。好，慢慢来。下次这个还不到。中
OK,
场
not
下
yet.
次
The middle
下
one,
次
the
比较
the
没有
deep one.
啊，这个有一些
Oh, OK.
很深啊，
You feel that?
酸吗？
Okay, that's
Patient
good.
saying that there's
Your son
pressure and it's
Yo.
like radiating down
Huh?
his legs.
Yo.
有，
Mhm.
这个，哦，这里还有，其实他怕扎针不用的，就是那个留一下，按一下就好了。
Okay, we're going to leave the needle about
他
多久？5分钟？
有酸啊，
留多久
到3-5分钟就够了。
？Okay, we can leave the needle like 3 or 5
一般来讲
minutes.
不是多久，再按下去，它已经没那么酸胀了，基本上就可以了。
Okay,
还有酸胀就再留一下，留到它没酸胀了，那就拔出来就可以了。
okay. So usually we will use our finger to check with patient. If he still feel very soreness, we can leave a little bit longer, like 5 minutes. If he feel better, so we can just take out the needles. So that's depend on how the patient feel. 看他的感觉，对吗？
对对，你说对，就看它还有没有酸，还有
You feel soreness?
Yeah.
还有
Okay,
I feel the needle, I don't feel anything,
还有
but when he presses, I start to feel.
okay.
还有
So you have to pressure the
没那么
patient
厉害了，
to make sure how the patient feel. 他说你压的时候他觉得好酸。
好酸还酸。
Patients
没
say
那
that
么
with
酸
just the
啊
needles, it
好
doesn't
酸
hurt, but when the doctor is palpating and pressing down is when he feels the pain.
还酸吗？
How did you
Is
feel?
it still sour?
是
Sore.
还酸，
Yeah, it's still sore.
还酸，
Not that bad.
还酸就留一下了。
Okay.
那它没那么酸的时候，
Okay,
拔出
and
来
then we can
Okay.
leave the needle
Yeah.
about like 3 or 5 minutes. So
The-
we come
right.
back to
The
check.
doctor's saying that when it's not
Yeah, just
sore
doing
is
the
when we
city
can,
region.
when you palpate and it's not sore anymore is when you can take the needles out.
其实啊，那个图都没带来，有带
哦
了。其
，OK
实那个是这个是好后上，哎，
Sore,
Sore.
酸。
酸
How about here?
酸
No.
酸
Yeah, 酸。
还是这里，
嗯
这个是合后上肌，这个其实是那个一直下来都是挺大肌啊，挺中肌啊，挺小，挺大肌，挺中
OK
肌，
Dr.
这里
Diao
挺
say,
小肌。
Dr. Diao say this area is couple of different muscle layered together. So this is the point.
Okay.
On the bottom have another muscle, on the top and then have another muscle together. So he would like to let the student to see the picture to check out the different muscle area. So why this point is more painful than other area? 不同的位置就是
其实你不分那么清楚，这也够算了。你解腹不舒服也无问题。
Okay, if you don't know if you don't know what exact muscle it is, that's okay. You just, find the right point. But sometimes you need to be a patient to very detailed to, figure out which area. 就是要仔细的找，对吗？
对，这是只是
嗯
找，其实它是臀部臀部肌肉劳损，
哦，OK，
这个很多哦，这个人这
A
个
lot of
病
peop-
很多，
OK，a lot of patients
非
have
常
this
多的。
problem. OK，
你去找到了阿细穴，找了以后就扎2针，
find the Ashi point
对，
and then use your finger to feel that. You must find the point which have feeling, pressure, soreness,
嗯
or a little bit numbness. How did
现在也没那
Pressure
么
and
酸
soreness.
you feel better than earlier? OK，
He's-
他说
yeah,
对， 现
Patient
在没
say
那么
he's
酸。
feeling
对啊
better
是
than
没那么
earlier.
酸，没那么酸啊，
That mean good.
一定好的，有酸扎到有酸状的一定好。
Okay, when patients say that they feel pressure, they feel soreness, that means your treatment will be, going very good.
刚才扎到这里没有就没有找到。
Okay, the first
Yeah.
area we put here, and then patient feel nothing. That means not this area.
Yeah.
That's not the right point. So we could keep searching a little bit down this area. So now here is the right point.
对，其实拔出来是可以的。我
OK
们一般吹中的这样子，那还是有点酸，
Okay,
它会有点紧
when
张。
when we pressure, he still feel something. But right now we're going to remove the needle.
我们扎针也要定位，
Okay,
我们拔针也要定位，
OK，
也要
so
在
我
这个这个手很重要，要
OK
定些，它会拔的时候会酸。你不是按下去拔的时候没酸。
Okay, the point is that when we want to needle them, you have to use your finger to locate the right location. So right now we want to pull the needle. You use your finger to push that area too. So make sure that area is right area, and then we pull the needle. 对不对？你用手压着，然后起
对
针。
对，吹中也要定位，它会还有酸，慢慢拔出来，
And slow down to pull the needle.
拔出来。一般来讲呢，它有出血，拔针的时候拔到最后是有出血，没关系。其实有出血也是好，还是
OK
好的。
Okay, when you pull the needle, you feel bleed, that's okay. Sometimes a little bit bleed will be help. So don't be scared or feel when you see the blood, you see that's no good. No, that's not right.
有
一点出血是好的。
有出血不怕。
哦
那
OK
个好的。
Don't be
假如你不
scared.
假如你想它不要出血，你到皮下的时候你要停一下。还
Oh,
是有点，停一下，
okay. If you don't want to see the bleed,
停一下
you
呢。
have to stop before you close to the skin, the first layer. You feel the needle close the first layer, you stop there.
表皮停一下，再拔出
And
来
then
就不会有出血。
you pull out the
一定说
needle.
没有出血，
So
有出血没关系都没关系。
okay.
这里，
Okay, now we
我这个
press
钉
the
的
area
钉在这里。
and then we pull the needle slowly.
慢慢
Okay. If you want to avoid the bleed, you have to stop the last layer. Pretty close skin, you stop there for a while and pull the needle. So that won't bleed. Okay, how did you feel?
好了，这个它扎完以后
Uh-huh.
还会很酸胀，那是
OK
最好的。
Okay, after needle, if you still feel soreness and then pressure, that means it's very good.
那有时候回去的还酸胀，那是
So
更
sometimes they will
还是
remind one day
不
or half day, so that's good.
不要怕，
Don't be
有
scared.
酸胀就好了。反正你酸胀，你脾气还有点酸胀不怕，酸胀以后一定好的，
Okay,
通常就一次就好。
okay. So when you have feeling after you home, like half day, one day, that means only one treatment can, totally you will
好
be
了，
good.
起来了，他还很紧张。
Okay, now you can get up slowly Okay, and then sit down and then we will see how did you feel. Okay, now okay.
那个讲过怎么样？好一些没
哎
有？
呦，他说
how do you feel? Like describe what you're feeling.
So right now I just feel like a little tense and sore, but not in a bad way.
觉得有点酸，
酸就好，
有一点
紧
胀，
紧的对。
有一点紧，对。
酸过以后，紧过以后，明天就很好。
Okay, tomorrow you will totally fine. That's what they'll say.
Will it be sore today or tomorrow?
Yeah, yes,
Okay.
yes.
Yeah, I think it feels better. Definitely not as tight. I
Okay,
feel
他
it a
说
little
松
bit
很
looser.
多，
对啊，对
松很多。
Yeah.
它会
Okay,
越来越松。我
okay,
就
you will feel yeah. So
It's great. Yeah.
so you want to stand up,
Sure.
move a little bit. Okay, so try to find the way you feel pain
It
before.
was more like picking up things,
Oh, okay.
but
他说他
It's doing
拿
good
东
right
西
now.
的时候就觉得哦好酸痛
So。just to repeat, the Dr. Dow said that the effect that you want after the needling is for the patient to feel soreness. And then that soreness will last throughout the day. So you will feel soreness, and as a patient, don't be freaked out or concerned because it's a normal feeling. And then by tomorrow, you would be feeling better. It'll feel looser, so you'll be fine.
it was a bizarre feeling when he had the needle in the right point and then was pressing on it. You could feel like the
Radiation?
It
Yeah.
feels
Wow.
big, right? It's
Yeah.
like a dull. It's like a dull.
他说
heavy
你的
pain.
手按它，他觉得哦，这个
Yeah.
这样子有那个，
对，会上课，
嗯哼。
会
Yeah.
松解开。
Okay, that's the real point. We hit it.
Yeah, it was the second point. Yeah.
Okay.
其他人扎都没这个。
Okay. If you try other acupuncturists, you don't have this feeling. That mean,
They're not good. Ask her
没
for your money
没
back.
有散没有散开松解的
Okay.
讲过了，就他们都没有，所以他们都在皮上面。
Okay.
你
You
看
say
我们扎3寸了。
okay. So the point is very deep. We almost hit
Yeah.
the bone, the very close to the bone area. So that is the point. Sometimes it's hard to find it. So we try the third time. That's why we get the right point.
Right. Yeah, it felt like it was kind of behind the bone.
Yeah. Yes.
Yeah.
Yes.
Great.
Okay. 那他回去需要什么？要做什么？要保暖吗？还是要 还
Ask
是
him
做什
when
么
he？ goes home,
暂
what's
时
after
动作
care?
不要太大。
哦，OK。
他这样子哈，一般来讲呢，都不会很酸燥，不会很痛了。
OK。
假如有真的是有时候扎的太厉害的时候，他也会有点痛。
嗯哼。
痛呢，一般也是急性、慢性转急性嘛，
嗯哼哼。
冰
OK。
敷。
Oh, okay. So that after home, don't have too much movement. Don't do like,
Exercise.
yeah, not too much.
Take it
Yeah,
easy.
take it easy, and then you will feel much better like day after.
Okay.
Okay.
Sounds
Yeah.
great.
So good.
嗯，
很好。
Yeah, before I couldn't even walk at some point. I had to go to the
Mm.
doctor for it. So
Oh, really?
it went away, but it never kind of left. But
Okay.
now we'll see what happens.
Okay. Sure. That's very good. Okay.
Thank you.
Okay.
好紧张。
10 minutes.
Okay, let's go ahead and take a 10-minute break, and we'll return
15.
10:10 or 10:15.
10:15.
Oh, 10:15. Perfect.
10:15.
很多
All
人
right.
在问你。
Go ahead and put your questions into the Q&A, and then when we get back from break, we'll answer them
高
for
已经
you
有
guys.
名片嘛，给他一张名片，他需要他可以找你。